Good morning, everybody. Welcome to Think Local Act Personal's latest webinar. We're here today to talk about direct payment support that's been happening across the pandemic period. And I'm really pleased to welcome two people who have been managing direct payment support services across that period, Catherine and Pat. Catherine, would you like to say hello to everybody?
Thank you, Martin. Hello, everybody. I'm Catherine Harper. I lead the SDS team for Medway Council. We're an in-house service. We sit under a streamlined reporting structure. My manager is the personalisation lead, and then she reports directly into the service manager, who reports into the AD. So it's quite a short reporting structure. We're a team of 11 coordinators. 4 of which got redeployed during the COVID crisis to one of our partner departments, Access to Resources, who arrange commission packages. And we have a good brokerage style relationship with them. We are responsible for delivering direct payments for people with social care needs, carers direct payments, short breaks also, for which we hold the budget for, and we deliver that in direct payments. And we were also a pilot site for personal health budgets and work very closely with our health colleagues to deliver joint funded packages.
Thanks, Cathy. And Pat, Pat, would you like to introduce yourself?
Yeah, sure. Thanks, Martin. My name's Pat Stack. I have 2 hats, so I'll briefly deal with both. I'm the chair of the London Self-Directed Support Forum, which we'll talk a little bit more about, I think, a little bit later. But I'm also the manager of personalisation support in Camden, which is the organisation contracted by the local authority to provide direct payment, to provide support to direct payment users in Camden. We have a team of 5 that all work throughout the COVID crisis from home. And remotely, and we provide support to all direct payments recipients in Camden. That includes children and families, it includes older people, it includes learning disabilities and mental health service users.
Great, Pat. Thanks very much. So without further ado, we'll get going, if that's okay. So just a little bit background from me, and then we'll get into what you really want to hear, which is what Catherine and Pat have been doing and what are they thinking about in terms of thinking about support for the future for the people that live in their areas. Can we have the next slide, please? So I guess at TLAP we've seen a mixture of practice up and down the country. We have been keeping our ear close to the ground, as you might well anticipate, and we've been very active in terms of working with government to try and make sure that there is guidance, and you'll all know that that guidance was slow to appear, but a little bit more about that later. We saw early that whilst that guidance was missing, people and support services in the sector actually stepped in and stepped up. And there's some excellent resources we thought were created whilst there was a void of guidance from government. We also noticed that the voice of direct payment recipients was missing. There's been a lot of dialogue with government and between the government and the sector, but we noticed that that voice of direct payment recipients was missing, and we have tried to make sure that voice is heard. We've been not shy about that. So there's good news on that front. Again, we'll tell you a little bit more about that later once you've heard from Catherine and Pat. So I guess the other thing to say about this particular webinar, there's been lots of great webinars, in particular In Control. A lot of you may well have been watching the series of webinars that In Control put together, largely focused around the experience of and individuals actually who take a direct payment, thinking about what can I do, what should I be doing, what do I need to think about. So we thought a helpful additional thing to do would be to present to you what councils and what direct payment support services have been doing. So without further ado, we'll move on. And Catherine, would you like to tell us about what you've been doing in Medway?
Yes, Martin, I do. First of all, I just want to say, Martin, that if you thought COVID was challenging throughout that time, then trying to get me to fit everything in 10 minutes and stop talking is going to be a bigger challenge.
Well, you could go to 12, maybe 12, 14. I'll put the stopwatch.
That won't leave any time for questions, though.
No, let's get on.
Okay, so we were quite lucky and quite well prepared, really, in as far as we started early. I think right back into about the end of January, beginning of February, we'd obviously been listening to the news and media, and we asked the question, well, what if, you know, it got over to this country and it was like China and things like that. So what we decided to do was to go through all of our direct payment clients, and especially the priority ones being the employers, because if they're employing an agency, then there's obviously a backup there. But with our employers, we needed to know who was the most vulnerable. So those people that didn't have any support networks at all, or family and things like that. And so we rated them on a red, amber, green basis. Also, as part of that initial assessment, we wanted to identify how many employees they were employing and things like that. When we rag rated them, we did it on the basis of critical needs, I suppose, the minimum that they needed to get through the pandemic. So it would be either people that needed medication, personal care and food. Obviously, you know, later on, as things moved on, the social care needs were not needed anyway because of the lockdown. So that's how we first started doing that in the end of January, beginning of February. In March, as information was coming across and it was getting more serious, we cross-trained all of the coordinators to be able to commission care packages. So for those people at that time, we was thinking, well, if these people have got nobody and the carers can't turn up because they're unwell or shielding or whatever, then how are we going to meet those needs? So initially, we trained up all of the coordinators to be able to source a commission package. 4 of the coordinators were deployed to the Access to Resource function, which is our partner agency within the council. And that was for 2 reasons. That was, first of all, to obviously try and meet the need of people with direct payments that didn't have anyone, but also to support the council in facilitating discharge from hospital to free up beds in case there was an influx into the hospital. And then, so we did all of that, and then lockdown came. And what a horrendous time that was as well. I mean, I don't think anyone's really recovered even now from lockdown. So when lockdown came, the first thing we did was we recontacted all of our clients, and this is quite, I'll be honest with you, the conversations were very emotional, you know, for coordinators, for clients. People were scared, they were having issues, they were panicking. You know, there was issues then started about the PPE, staff not wanting to go to work because they were scared of contacted, clients not wanting people to come in. We did a lot of conversations about educating clients and employees around keeping safe, to try and get the whole thing back into perspective for them, because people were just going off all over the place. So we identified the issues people were having. We made sure that they had access to one point of entry, which was our duty line. We have a self-directed support duty person every day between 9 and 5. They had a one place to go to, so we made sure they had that contact detail. We also supported them with any information that was coming down from Premier Insurance, because that was, I mean, as you know, Martin, that was changing almost hourly, you know, at some points. It was, so we were constantly supporting those with the staff. And then there was PPE, you know, and I think as with everybody else, other authorities or organisations that deliver the same kind of service, whether it was in-house or external, PPE was absolutely horrendous. To get get the DP employers recognised as a sector, as a provider to need PPE for their clients, for their PAs. So we still pursued that. My manager, she was pursuing that, and my service manager trying to get that recognised. But what we did as a backup, we then worked with one of our external partners, KPM Accounts, and we set up a pooled budget in an account. So we pooled the funds from people's direct payments, we put it into one account, and they sourced us the PPE. And then what we did was people would ring us, the duty line, and we would then arrange for that PPE to be delivered to them. We made sure they had a month's supply at a time, so that there wasn't sort of like every week in crisis, and then they would ring us until their suppliers could actually get back to supplying them direct. I mean, people were our employers, they were ordering PPE, but I mean, I remember one lady, she had, I think it was like 5 boxes stuck in Argos, because she ordered them, and before she could pick them up, Argos had closed. So, you know, it's not even as if our employers weren't prepared, or even, you know, not even bothered. You know, it's just that it was the circumstances of everything locking down. So so we got over our PPE thing, and it worked really well, and it took the stress out of it for our employers. I'm not sure it took the stress out of it for my coordinators, but it did take it for the employers. We also actually in PPE work really closely with our health colleagues, Linda Widnall, at the very beginning, because of the change in tides. So we'd work in partnership with regard to sharing information, what progress they'd made, what progress we'd made. And I think even on one occasion, we actually managed to provide some PPE to a health funded client, because they just couldn't get any there to them. So again, a bit of partnership work. And I think this was key throughout the whole crisis, you know, partnership working with everybody. We then looked at obviously meeting the needs of our clients, especially the ones that we had assessed and as needing, came into our red category. Government guidance came out around us about the paying of PAs and things like that, and continuing funding the direct payments, which we did. And we made a decision at the very beginning, when that guidance come out, was to continuing to pay our self-employed PAs, on the basis that if they weren't needed, or the client didn't want them to go in, they were to go onto a list for us to use for people whose PAs couldn't work for whatever reason, and they would have to pick up that cover, which then what that enabled us to do then was to not drain any resource from the commission packages, which would be left for doing their bit over there. So that was a really good outcome to that, you know, people. And the other thing we did also without hesitation was to allow people to employ family members, even living in their same home, because, you know, it's about safety, their needs need to be met, and, you know, and why would you want somebody else to go into the home to, you know, open them up to maybe possible infection of COVID when there's people in the home that could do it. So so that was two really, I think between the two areas, self-employed PAs and paying people, family members, we covered everything that needed to be covered during that period. We also did, throughout that time, we did an awful lot of support with equipment. During that obviously, like when the day centres closed, there was a lot of people at home, so stress levels really sort of kind of started to increase after. I think at the beginning it wasn't too bad, but as time went on, stress levels started to rise. So we looked at equipment where we could, people could see faces. I think one of the ones that stuck in my mind, we actually allowed someone to purchase an app through their direct payment. It was like a meditation app, and it helped the carer to just go off and meditate for half an hour, and you know, to be able to continue with their care. So we was quite creative and open to anything that people were asking, you know, that was going to help them through the crisis. So that was probably more the direct support. I think one of the advantages Medway have is that the group of teams that's managed by my manager are all interlinked in some way. So and because of that, we see the whole picture rather than just self-directed support. So throughout the whole pandemic or that crisis period, we was working with quality assurance with regard to day services and how we were going to, when they closed, about what different type of service they were going to provide for people at home. Because one of the things is, like, we also over financial assessment and income and debt recovery, Karen was able to make very quickly with Gold and Silver Command the decision to suspend client contribution for people that weren't receiving a service, because people, that came into the mix as well. And we also continued to set up direct payments for priority and emergency people. So there were people that maybe had an agency or a day service that they couldn't go to, that was, say, commissioned, but they wanted to employ somebody, and so we would, we adapted our policies and procedures to actually get those set up quickly to enable that to happen. So it was quite a challenging time.
Yeah,
quite a challenging time.
Can I just ask, encourage you to just let us know what you're thinking for now and into the future, because we've got about 12 minutes. So
okay, I did say, I did warn you. Yeah, just tell me to shut up. Yes, I'll be quick. Obviously, we've probably got the same concerns as every other authority. We were concerned about day resources not being able to take back the full capacity because of the social distancing. And so what we're actually doing at the moment is, with the quality assurance department, is looking, we've got all their recovery plans now to make sure they are considering all the social distance and how they're going to do that. But we're also working with providers and PAs to try and get some local micro enterprises for smaller groups of people to meet, maybe in a local hall or something like that, rather than send them to bigger day services. So that's what we're trying to do with that. And the other concern was the PA workforce. That there was such a lot of they were so scared at the time. We was worried that was going to fall by the wayside and we was going to get a reduction of PAs. So we are going to be looking at a recruitment drive for that. But also, what we're all very keen as a authority, is to look at how we can reduce the physical need of somebody with equipment. So, for example, can we get somebody to go in once a day to do the medication for the day on a timer and a video link to prompt somebody, things like that. So it doesn't need somebody going in 3 times a day to do medication, only once. So we're kind of looking at those kind of things for the future. Yeah, I think that's enough from me, Martin, don't you? I think we need to let Pat have a say, because I know he's got some interesting stuff to share as well.
Indeed. Just before we do, Pat, if that's okay, I did get a little bit overexcited at the beginning, and I should have said to everybody who's listening, just to let you know, this webinar is being recorded. You'll get a copy either directly emailed straight afterwards, or if you don't get that, drop into email a link to it. By email, we'll send that out on TLAP's newsletter. And the other thing to say is, please do start asking questions. You should have the question function. I can see 1 or 2 coming through, so please do ask your questions as Pat starts to talk. Please do get those questions coming in, and we'll have a good 20 minutes asking Catherine those questions. So without further ado, Pat, can you let us know what life's been like in Camden and what you've been doing to support people with direct payments in Camden?
Yeah, sure. And I apologise if quite a lot of what I say isn't that different to what Catherine's been talking about. I think Catherine and I have shared a lot of experiences over the last few weeks anyway, but B, obviously things were very similar. I think for us, we work remotely, but like Catherine's team, we did have a duty number which people could call and which people could respond to. And I think the thing that we found right from the beginning was that we were having to deal with and talk to very large numbers of people, again, some targeted, others coming to us, who were experiencing real fear. I mean, the general fear of COVID itself, people with health issues, also the fear of isolation, people who perhaps are the only person they see much of the time is their PA or their PAs, and suddenly they were worried about that. And there was a real fear that care would collapse, that there would be a collapse in the process. And so the first thing that we wanted to do was to make sure there were as many alternatives as possible so that that collapse would not take place. The first thing that Camden, the council, did, which was very important, was to say that people could employ family members. I think that was crucial at that point in time. If people were isolating and didn't want the PAs coming in, or the PAs wouldn't come in, then there were family members there who could be employed to provide the support that hadn't been previously. The second thing we did was to do a ring round of every care agency in the area to see if they were taking on people during the crisis, and about 75–80% of them were. So we were able to reassure people that we had a backup if necessary for them if there really was an issue where PAs couldn't get in and they couldn't get care any other way. We also discussed with people the idea of pooling PAs, but there was a reluctance around that because people didn't really want PAs who'd been in other people's houses coming into theirs, or their PAs going into other people's houses. So we, in the end, didn't go with that option after giving it some thought and consideration. Obviously, where any direct payment users were happy to do it, there was no problem, but it couldn't be offered as a general solution in that situation. I think the huge concern that people then had was about the PAs and about their relationship with the PAs. People have PAs, many of them have had them for a very long time, and many of them see them as a very, very important part of their life. And therefore there were questions of what would happen. What if the PA was shielding? What if the PA wasn't shielding but just didn't feel that they wanted to risk coming in? What if the service user just didn't want the PA to come in because they were nervous about anybody coming in towards them? What was the legal situation in those circumstances? What should they be paying people? How could they maintain a relationship in which they would keep the PAs rather than just say, right, I don't want you in, I'm not paying you, goodbye, and the chance that the PA would then go and get other work. And again, there were two things we had to do. One, Catherine mentioned, was constantly update people on the legal advice that was coming out. And a big thanks to Premier Care, who did play an important role. But also, it was fantastically challenging because at one stage, government announcements seemed to be changing almost daily around employment rights and so on and so forth. So that was very important that we were able to keep that advice updated. We had it updated on our website. All our team members were aware of it, and so on. And Camden did see as a priority people maintaining the relationship with the PA. So like Medway, there was an agreement that PAs would continue to be paid throughout the process, so that relationship would not be broken. There were other questions that came up. For a while, there was confusion. People asking, are PAs key workers? And we had to reassure people that they definitely were and had to be treated as such. And that had certain implications. In early days, we'd had one or two people in the height of lockdown. We'd had one or two people stopped by the police while travelling. And so we negotiated with Camden, and between us produced a letter that PAs could take with them to ensure that they could travel to and from work. And so I think that all of that was very important in reassuring people, both that their short-term care was in place one way or another, but also that the long-term interest of protecting the relationships they had with PAs, who added greatly to the quality of their life, would be continued. Unlike Medway, where services couldn't be offered, day service and so on, then the contribution was suspended. The next question, again, very similar. The next big question was PPE. Camden was very quick to tell everybody they could use their direct payment money to purchase PPE, which was great. But the real difficulty was, where did you get the PPE? And here there was a real crisis. It wasn't a Camden crisis. It was, I think, you got the feeling it was a very national crisis. Some places somehow seemed to manage it, but the general guidance was very confused as to who was entitled and where it could be got and so on. And we found ourselves as a support service troubleshooting a number of individual cases around PPE and having to find ways of ensuring that the person could get PPE. And we made Camden aware that this was a real issue for people, that we were getting large numbers of calls and that there was nothing in place. And Camden then put a structure in place where there was a pickup point where PPE could be got by direct payments users, and where PPE could be delivered to direct payment users. And that eased an awful lot of tension. That eased an awful lot of worry, because without PPE, people were fearful for themselves, and also, in fairness, fearful of infecting the PAs who were coming in to provide the care and so on. And so I think that was very important. We also, to a lesser extent, but perhaps this will grow, got questions about testing and who was eligible and how it could be obtained. And that's something, again, that we've been able to respond to. And luckily, guidance has become more clear about who's entitled and also the ways in which you can get it. But initially, people would be sent from pillar to post. They would ring their GP, who would tell them to ring the council, and straight enough, it would end up with us. And we were solving it, but we knew that had to be a long-term structural thing put in place. The next thing that I think was very important was the emphasis that people could use their direct payments flexibly. For those people who couldn't access day services or therapies, or parents who couldn't access play provision, or just for people at PAs who couldn't come in, the ability to be imaginative about how they resolve those problems and to be allowed to be imaginative about how they solve those problems was very, very important indeed. And we saw a number of cases where people were allowed to purchase a laptop, where they were allowed to purchase online play facilities to keep their children engaged, where people were allowed to use the PAs even if they couldn't come into the home to perform other tasks like shopping and so on, so that people weren't being told you have to spend the direct payment in this way, but actually think imaginatively about how you're going to solve the problem. And I think that was very important. Going forward, because I'm conscious of time, going forward, I think there are two things we're looking at really going forward. One is, how do we emerge from where we are? But secondly, less optimistically, how do we cope with any sort of second peak or any return, any big step backwards? And I think those are the two things that are very, very important. And I think one of the things that has to be said is that at a national level, when this crisis occurred, it really felt like direct payment users were the forgotten group in social care. And Martin and Catherine and I, TLAP and our organisations have all been involved in drawing up the guidance, which I think will be a very, very good guidance indeed coming out. Which come out, but which would be lovely to have at the beginning of the process, rather than where we are now. But I think there will be a lot in that. Martin will talk much more about it. That I think will help carry us forward. We have to be able to, I think, going forward, mend employment relationships where possible if they become fragmented. We have to begin going forward to say, what will we put in place to ensure that happens in the future? How do we enable recruitment with a plan that safeguards the relationship between the worker and the PA? If you're going to be recruited as a PA, how do you know you won't just be sacked the next time somebody's told they're locked in or there's a lockdown, etc. It's very important that those things are put in place. We have to revisit how day services can be utilised best and so on. And I think those things are very important. And I think the last thing I want to say is that at the beginning of direct payments, flexibility of the use of direct payment was something that was emphasised as very important. And somewhere along the line, we lost that. And direct payments became much more prescriptive and much more restricted in many areas, not all areas, in many areas. I think we have to view that the flexibility we've used in the COVID crisis, say it's absolutely essential that we extend and expand that going forward through any new crisis and beyond crisis to make flexibility the new normal in these circumstances. I think that's me, Martin. Thank you.
Thanks, Pat. Thanks. That is great. Thanks for those two experiences from different perspectives. One, an in-house service. One, a disabled people's organisation, which is commissioned to provide direct payment support in Camden. Pat, just before we go on, can I just ask you to just let people know about the London Self-Directed Support Forum and what you've been doing in COVID to support members of that forum?
Yeah, sure. So the London Self-Directed Support Forum is a forum made up of, as I like to say, coal-faced direct payments professionals, people who work on the day-to-day around providing support around direct payments. And they include people from disabled people's organisations, from voluntary sector organisations, from local authorities and other individual brokers and so on. So we have quite a large breadth of people. And quite early on in the crisis, we decided to hold a Zoom and national London-wide meeting, which was very well attended, and which you found that actually almost everywhere people were facing the same problems and looking for the same answers. And so the forum has really set itself throughout the whole process of this crisis to be able to provide those answers. We've had, I think, 3 meetings, 4 possibly in the period, as well as then attending a whole number of other meetings as part of the forum, including the guidance discussions and so on, to try and ensure that we can pool the resources of best experience going forward. So I think the London Self-Directed Support Forum, I've been the chair of it for quite a while, and I think it's always been a very useful organisation. I think it's really shown in this period just how important it is to have that sort of forum for people who are having to deal with the day-to-day issues that we're facing in the crisis.
Yeah, and as far as I'm aware, it's fairly unique. We know there are 1 or 2 other regional meetings, but that happen. We know that Skills for Care puts some regional meetings on once a year. But as far as I'm aware, it would be useful to find out from people on the line whether or not the London Forum is unique, and whether or not something like it, where you live and work and provide support, whether you would want something like the London Forum. And there's a great experience of and knowledge of how to do that already done in the London Forum. And certainly at TLAP, we'd like to see more of that happening in different parts of the country.
I should just say, Martin, well, although we're the London Forum, we are sort of expanding our tentacles to beyond London to the south, because I do think people in Kent and elsewhere have told us that there is a need, and we welcome them in. And I think we'd like to be a model for other forums that could go forward.
It'd be interesting to see what people think about that. Okay, so I think the next slide should be a big question mark. No, it's not. It's me. It's me. It's me. No, we're not quite at the question. So we just wanted to just let you know some of the things that Pat was intimating and Catherine have been intimating in their discussion. So we've covered the London Self-Directed Support Forum. Thank you for that, Pat. So we and at TLAP we were part of, I guess a round robin is the best way to describe emails in the early part of the response to the outbreak. There were attempts to get guidance out at an early stage. We've kind of learned about the infrastructure of government and just how difficult that is. So there were long delays, but once guidance was out, we've built a bit of a relationship with the policy leads writing the guidance at the department. And you may remember there was the primary guidance, which is on gov.uk website, and also a question and answers, which initially sat on Skills for Care site. And we just thought there's an invitation to update that as soon as it was published. What are the issues? Just keep things live, to update that. And we just thought, actually, this is a really good opportunity to say to people at the department, you can ask us at TLAP, but actually, this would be a really great opportunity to co-produce the guidance much better. So we did pull together a group of people like the Self-Directed Support Forum, including In Control, LD England have been part of the discussions, Skills for Care, a whole range of direct payment recipients, mainly members of the National Co-Production Advisory Group. And then we've worked with health, and we've tried to broaden it out to get a discussion to help the department get a feed in from people who taking direct payments and the people working to support direct payment recipients, to make sure the department's got a really open channel. We've been meeting once a week with the policy leads there, and we've helped shape the guidance, helped the policy leads to write that guidance hopefully in much more appropriate format, useful format for councils, for direct payment recipients, and for direct payment support services. And we're also now working with the department to think about the emerging issues that Catherine and Pat talked about. So keeping the guidance live, we're currently working with those policy leads to update what became the full guidance. Unfortunately, they couldn't keep the name, question and answers. We did make sure the wording stayed the same, but the title of the document had to change. The question and answer document had to change because of the comms people at the government. But there we are. I think it's fair to say, I don't know if you got any comments, Pat and Catherine, about the way we've been able to sort of help government shape that guidance and keep the wording as it has been.
I mean, I have to say, I think for the first time in all the years I've been doing this, I actually feel that they are actually listening to all of the organisations and service users as to the problems, and I think they are genuinely trying to address those things. I think they've taken on board, I mean, throughout the whole thing with the PPE, that was fed up, and they made sure that it came down to the resilience forums, that these people have to be recognised. I think they've taken on board that actually the guidance needs to show that to sort of kind of say about the flexibility and give examples. And there were lots of, even though guidance was coming out, I think the other thing they don't realise is that when they drill down, they make a decision, they say about the furloughing of staff and these circumstances, but it's only when it comes out that we have to support our DP clients to break it down into individual circumstances, and they've been very good in coming back and giving us, when we've given them examples, to coming back and addressing the answer and giving us that answer. So I personally feel that all our meetings has been very positive with the Department of Health and Social Care, and very productive. Yeah. I don't know about you, Pat. I don't know how you feel.
Yeah, I haven't got much to add. I would like Catherine. I've spent years going to meetings, consultations, giving, the view and so on. This felt completely different to almost all of those meetings. It really felt like a co-production, or in reality, that we were sat there actually going through it. We're being listened to, questions were being taken away, answers were coming back that made sense. I think it was a very, very positive experience, and I have a lot of praise for the people from the department who work with us. They really respond. Okay,
so thanks for that, and maybe a little bit more on that right at the end. The next slide should be a big question mark. There we go. So questions, we've got lots of questions, in fact. So if it's okay with yourselves, we'll get stuck straight into those. Catherine, a nice, easy question to get going with. We've got a question: how many service users or direct payment recipients do Medway have?
We have in total about 800, and I would say nearly 400 of those are DP employers.
Okay, thank you.
Yeah.
Just as a supplement to that, we do have a question about, because you mentioned about self-employed personal assistants, and we've kind of got a question: is that allowed? That's not a question, but I think your setup in terms of what you've done is really interesting in terms of the mix.
Yeah. Yeah.
I think the answer in terms of, well, I shouldn't be answering it, but I think the answer is it's about tax status. So I think you do things cleanly in terms of that. Sorry, go on, Catherine.
That go back 2 or 3 years ago, and that was the $1 million question. You know, is it allowed? Is it not allowed? And we've worked. I have one of my team members. He was tasked with looking at self-employed PAs and how we could make it legal if it wasn't legal and things like that. So the big thing was the tax status. And obviously we were concerned about people's vulnerability, safeguarding, and also the basis in which they are going to be engaged. So I don't want to take too much time on this because I want other questions as well. But what we do is that we make sure that when they sign up with us as a self-employed PA, that they have the correct service agreement. So Premier Insurance, they have a service agreement. When they sign up for their public liability insurance, they have access to their service agreement, which they can then negotiate with the person. That has to be revisited every 3 months, renewed. So the self-employed PA will every 3 months sit down with the client and say, right, you know, has the service changed? What we're going to do for the next 3 months, so that you can evidence that. We also make sure that they have a letter from the Inland Revenue to say that they do account for their own tax. And we make sure that they are DBS'd, and the DBS is carried out every 3 years.
Okay.
Now,
Thanks,
what
Catherine.
that does, oh, sorry, can I just say,
Right.
what that does is, because we were listening to a lot of our DP employers who wanted to be DP employers, but they didn't want to go through the whole PAYE route and all of that stuff. So this was like kind of like, but still wanted that control and of saying when they want their support. So this was the halfway bit between PAYE and having a commissioned agency.
Yeah, and am I right in thinking sort of strategically working towards having that mix of individually employed personal assistants and self-employed to actually pay dividends at this time?
Absolutely, yeah, absolutely.
Yeah. Just one other question for you, Catherine, at this point. Somebody really impressed with your use of technology. Do you think this could be used as a way in the future to do annual reviews?
If you're talking about a direct payment review, we do a very light touch direct payment review anyway, because we use the prepayment card, and it was received very positively in Medway, because what that enables us to do is just to online just run down the expenditure, and providing that's in line with what's on the support plan, then we just sign it off, and we look at client contribution. With statutory reviews, well, I think anything's possible now. I mean, the one thing that, we've worked from home for the last goodness knows how many months, and reviews are still going on, aren't they, by the telephone? I wouldn't say that that's necessarily ideal, but what I personally would like to see, and which is what we're going to go, if we could get these video phones in people's homes where people can talk to their family members, and there's no reason why a review couldn't be carried out in that way. So we, as a team, we work with remotely as far as we've got. And I would say probably 99% of the time we're able to carry out our work remotely. There's just that, just that 1% where we have to go out, and we've had to do that because of COVID, to take it to that next step. So yeah, I think it can be used for reviews in the future, definitely.
Okay, Pat, we've got a bunch of questions around day service. You talked about day services and thinking about day services and charging for day services and things. So we've got a question here. Can family members who support service users during lockdown, when PAs and carers could not come in, be paid from their direct payment in retrospect? What was the situation in Camden?
Sorry, could family members who were being employed be paid in retrospect?
Yes.
Yes, I mean, you could, once it was agreed, if you could show that they were providing the care in that period, you could, in this case, we would register them as an employee, and they would be paid. So even if they hadn't realised they could do it at the start, but they were doing it, and then realised you could certainly retrospectively set that up. Yes.
Okay.
But obviously not retrospectively prior to the COVID crisis.
Yeah. And did you get involved with the council in terms of the dialogue with Camden Council? Are there other models of outreach that you've considered in terms of day services? I think you mentioned some of that.
Yeah. So in terms of what would happen with day service, because obviously during lockdown all the day services were completely shut down, and now some of them are beginning to carefully reopen, but it's difficult. It was a case of looking at each individual and discussing what it was they thought that they might be able to put in place that would replace a day service or a therapy. So, as I said, we had a mental health service user, to give an example, who was having a session of therapy every week and was also going to a centre every week for activities, and who now could do neither. But she said if she could get a laptop, there were a number of things she could engage with online that would help break the isolation and that would play some of the role that had been played before. And that was something that was agreed to immediately. She was able to purchase the laptop. It was, she wasn't paying for the day service, so the money was there. She was able to purchase the laptop and able to use it in ways that absolutely played the role that she wanted it to. Similarly, we had a number of parents of disabled children who identified either physical things, toys and things that they wanted brought into the house to keep the child engaged and active, or learning activities that kept the child engaged, or online activities. And it's a question of being imaginative, trying to locate what it is that the person thinks would best suit them or their child, and then say, how can we go about getting this? Because we can't deliver what's normally, or Camden can't deliver what is normally being delivered. So it is a question of being imaginative about how you do that. And then, of course, there is the process of them beginning to talk to day services as they begin to reopen, to find out exactly on what terms they're doing so, and so on.
So if we just continue this line of questioning, if it's okay for either of you, or it'd be interesting to hear from both areas. The sort of questions around day services reopening, and actually, are you both in active conversations in your council areas about moving away from building-based services and buildings in a second wave contingent, and building in a second wave contingency around that?
Yeah. Well, we have been talking to day services for quite some time now, because we were concerned that, even if there wasn't a second wave, they were not going to be able to take back the full capacity they had before. So with our quality assurance department, we've been working together to, as part of their recovery plans, to find out how they're going to meet the needs of the people that they've got going in. And that may mean that they're going to have to look at an alternative model. And some of that may have to be either in the person's home or in the community or building based. So I think the one thing we know is that day services are not going to be in the same shape and form going forward, because and I think this is also a very good opportunity as well, because like I said earlier, the one thing we are doing is we're working with a couple of providers and trying to group together PAs of people to perhaps go locally, and we've got one of our Who Cares, which is one of the community-based things. They've got availability of volunteers that can help with things like that. So we are going to take this opportunity to look at things very differently, and move away of the total reliance, I suppose, on building-based day services. I'm not saying there's not a place for them, but you know, I think there's an opportunity for us to look at something different now. We've been forced to do it, basically, as you know. I think everyone would like to do that, but now we need to do it.
Yeah, thank you, Catherine. Is that an active conversation you're having in Camden, Pat?
Yeah, obviously we're in a slightly different position because we're not in-house, so the immediate negotiations between Camden and day services would not be something we would necessarily be involved in. What I think we'd be looking at is where are the opportunities if direct payments users want to use them? What could they look like going forward? And also, have people discovered they've gone for an alternative in the lockdown and actually come out saying, you know what, it's better. It's better than what I had. I'd rather keep it. And I think we have to be listening. It would be terrible if those people told, no, the day service is open again. You can't do that anymore.
No.
Actually, it works better for people who do it. So I do think there'll be challenges. I mean, on a sort of partly, I think there still is a role for you know, an important role. People do want personal contact. You know, to sort of withdraw everything remotely, I could see real difficulties with people want their children to engage with other children. People want to engage with others. So we have to find ways of making sure that facility is still available. I know as our team, we've managed remotely throughout, but parts of the job are much more difficult because you can't actually sit down and have a face-to-face chat with someone, and they find it much more difficult. So I think that has to be taken into account into any new model. Is, you know, there isn't sort of a one size fits all when it comes to remote and so on.
Okay. Another straightforward but really important question: communication. How do you communicate with your direct payment recipients? Is it letters, emails, phone, or what's been the best way of communicating with people?
We found telephone because throughout that whole time, people needed to speak to people. They were so grateful, and it was the best way, really, rather than a cold email. We could ask the questions that, you know, rather than have it scripted and, you know, narrow. But yeah, we found definitely talking on the telephone. It was time resource, and you know, we were all sort of on the telephone, and some conversations could take up to 3/4 of an hour where people were needed reassurance and had no contact. But yeah, definitely telephone for us.
Yeah, I mean, I agree. I mean, you know, there were things we could do, general advice we could put up on the website. Obviously, we would deal with people with emails, but people wanted, each individual is different and people want that reassurance. And I think we found phone to be by far the most effective way of communicating.
Thanks, Pat. So what about personal contributions? So were personal contributions suspended for people who were paying PAs but not getting a service?
Yes. Yeah.
Straightforward.
Because,
in Medway?
well, yeah, no, it was because they wasn't getting a service, and it was a decision to continue from the guidance from government that we continued, and we paid full pay to protect the market force. But no, if they didn't receive a service, any support, then their contribution was suspended. Obviously, you know, sometimes people had a mix of support. Some people had commissioned and a direct payment, in which case, if they still had that part of the service, they would still pay. And when the day services, they didn't pay when the day services were couldn't go to the day service.
Okay. Is there anything? Okay, Pat?
Yeah, where the direct payment was suspended or the service was suspended, then the contribution was suspended also.
Great. We've got a question sort of relating to, anyway, I'll just ask a question. Could the direct payment be used for PPE? Would that not take away from paying for PAs? In Northern Ireland, the local trust provided the PPE, albeit a month after lockdown. So I'll just say, in terms of at TLAP, we've seen a whole mixed bag of approaches with PPE. But let's just hear from Catherine. I think you talked about PPE, in fact, in your dialogue, didn't you?
Yeah. I mean, we would cost in PPE as part of the direct payment budget anyway, if PPE was required to deliver personal care. So they should, you know, even without COVID, that should be there. So they should be buying their PPE out of there. But we pulled the budget during the crisis because people couldn't get hold of the PPE. So we took that sort of onerous thing off of them, and then we delivered it until that they could start getting their own PPE. What we're doing now, we are still continuing to get PPE because there's a whole group of people now that wouldn't have normally had PPE because don't have personal care, but because of the guidance, they do need masks and things like that for when they go into shops, or if the carers go into shops or things like that. So for those people, we're still coordinating and delivering that for them, and it works really well. It's something that we don't particularly want to change, and maybe going forward we may ask other people that receive personal care whether they want to continue doing it themselves or for us to coordinate it for them.
Okay.
Yeah, and in Camden, I think there were 2 or 3 different things. First of all was that people told they could spend their direct payment on PPE, and obviously where they had the contingency to be able to do that, and many people did, then they could do it without affecting their PA budget at all. If anybody couldn't, then obviously they could go back to the council and say, I need extra funds for the PPE. And then when we actually put a system in place, the PPE was delivered to people free. So, so it was,
Okay.
there were 3 different ways of dealing with it.
Yeah.
Okay. Here's an interesting one. Did eligible needs get superseded by flexibility? What safeguards have you got in place about allowing family members and buying laptops and things, allowing family members to support and be paid at 100p? Are these short-term agreements? And there was a related question around that. Have you actually put in place short-term contracts of employment for those family members providing support?
Yes, we did, and we reviewed all of those ones that we had. What we do is we have an exceptional circumstance process to go through that we get signed off by our line management and the reasons why, and then we set a review date on that. Because it's a family member unknown to them, we were able to do it quickly, with the DBS and things like that, and they're meeting eligible needs. You know, we're providing a service based on their assessment, and obviously we rang round everybody to find out what are their most critical needs. So if they needed personal care and they needed food or medication, well, that's what we would pay for. We wouldn't pay for anything else, only the eligible needs, unless during that time it became an eligible need. You know, lots of things arose. It could be, and that could be temporary, you know. So yeah, we did have a review process, and when that crisis would come to the end and the PAs were back, then the PA would come in and meet the eligible needs as well. The only eligible need we didn't meet was obviously accessing the community, but then we couldn't. No one could do that because no one was allowed out.
And Pat, just one more. Oh, sorry. Can I just ask Pat one last question, if that's okay? Because it's nearly 12 o'clock. Gosh. Pat, is the guidance you're speaking about something you can share or be available to view somewhere? So the guidance you were talking about, I think that's the guidance we were working on together, which is
Yes, it is. It's the one we're working on together, Martin.
Yeah.
So and that one will be shared, won't it?
Yeah, so I mean, the current guidance that we were talking about is actually the stuff that's on the gov.uk website. We are working on an update to what's called the full guidance, which is the guidance for direct payment recipients. We're hoping that'll be out in September, I think, the likely timescale for that. But a whole load of stuff around thinking of coming out of lockdown there. Sorry, Pat, anything?
Sorry, yes, that was the one I was talking about. Obviously, the one we've worked on is available. Yes, that's right.
Okay. So just some last words. Can we have the last slide, just so that people have got contact details? Thank you very much. So it's 12 o'clock. That's gone really fast. There are more questions. We'll see if we can have a look at those questions and get some responses to people maybe on a newsletter very shortly. We'll get those out to you. But thank you for listening. Catherine and Pat, thank you very much for joining us. Would you like to say goodbye to people?
Goodbye. Thank you for listening.
Yeah, thank you very much for listening. Thank you. It's been a pleasure to talk to you. Bye.
Thank you.
Is it over?